Life is a winding road, no telling where it goes. Driving through days and nights, won't stop for traffic lights. And I really wanna know, if I'll ever figure out where the road goes. Even if I'm falling down, I will keep on searching for my highs. You can say I lost my mind, I will keep on holding my head high. Even if the sky is falling down. Jumping from cliffs so high, trusting our wings to fly. Sometimes we're crashing down, but we get up and start from the ground. And I really wanna know, if I'll ever figure out where the road goes. Even if I'm falling down, I will keep on searching for my highs. You can say I lost my mind, I will keep on holding my head high. Even if the sky is falling down, even if the sky is falling down, yeah. The sky is falling down. Even if the sky is falling down, even if the sky is falling down, yeah. The sky is falling down.
All right, welcome folks to the Swift Healthcare Live first inaugural broadcast. I am delighted that we're able to do this, and I am delighted that Dr. Robert Pearl could be the first guest on the Swift Healthcare Live episode. Dr. Pearl, welcome to the show.
It's a pleasure to be here, Patrick. Looking forward to it.
I'm so glad and I'm so grateful. Thank you so much for being our first guest. Dr. Robert Pearl was a guest on 2 episodes of the Swift Healthcare podcast, and that's a podcast exploring the intersection of healthcare and leadership. And this is the inaugural Swift Healthcare Live, and we're going to be doing this live, and then of course it's going to be available on multiple platforms as well. So we're recording this for posterity's sake as well. So I'm really excited about it. So just Dr. Pearl, if I may, let me give you a introduction. The introduction for you, there are so many things you've done. And I know you're a humble man, but bear with me. Don't interrupt me as I read this stuff, because there's so much I could read. But Dr. Robert Pearl, folks, if you're watching this live, if you're watching this post live, you are in for a treat listening to Dr. Robert Pearl. And let me share with you his bio, and I've got to read it here. It's delicious. Healthcare leader, author, educator, columnist, podcaster. Dr. Robert Pearl is the former CEO of the Permanente Medical Group, the nation's largest medical group, a former president of the Mid-Atlantic Permanente Medical Group. In these roles, he's led 10,000 physicians, 38,000 staff, was responsible for the nationally recognized medical care of 5 million Kaiser Permanente members on the West and East Coasts. He is named one of modern healthcare's 50 most influential physician leaders. Bear with me, Dr. Pearl. Dr. Pearl is an advocate for the power, listen to this, power of integrated, prepaid, technologically advanced, and physician-led healthcare delivery. Sounds good to me. He is the author of Mistreated: Why We Think We're Getting Good Healthcare and Why We're Usually Wrong. That's a Washington Post bestseller. And all the proceeds from the book went to Doctors Without Borders. And his book that has just come out, which I'm super excited about, is Uncaring: How the Culture of Medicine Kills Doctors and Patients. Dr. Robert Pearl, welcome to the show.
Thank you, Patrick.
I'm so glad you're here. And I've got a banner that I'll put on here as well. And Dr. Pearl, there's so much we can talk about. In the podcast, we're able to deep dive into multiple areas of the book that you've done, as well as your experience. And what I want to do in this LinkedIn Live, YouTube Live, Facebook Live broadcast is for us to talk about the book, the momentum from behind it, why you did the book. Let's talk about the patient impact, the physicians and the healthcare providers' impact, and also what it's like doing a book tour. Never having done a book tour like myself, like you are doing, it just sounds extraordinary and it sounds delicious. So, let's start with Dr. Pearl. The book itself. I want to ask you, why this book? What inspired you to be writing the book on top of everything else you've been doing?
You have to start, Patrick, with the last book I wrote. So it was 2017. I was in the final part of my tenure as CEO in Kaiser Permanente, and I was worried about healthcare across the nation. I saw that we were the most expensive country in the world, spending $11,000 per person, with Switzerland at 9 and Germany at 7, and everyone else half of what we spent. And I simultaneously saw that, according to the Commonwealth Fund, we were last amongst the 12 industrialized nations, last in life expectancy, last in childhood mortality, last in maternal mortality. And I had seen something that I thought was better. Not that I thought Kaiser Permanente was perfect, but I thought it was just better in terms of the outcomes. NCQA, we were number one in the nation of 1,000 places. Mortality from heart disease was 40% less than the communities around us. You go down the list of pieces, and it seemed like a much better solution. And so I wrote the first book to talk about what I saw to be the systemic problems. I saw an insurance world, the fee-for-service insurance world, where doctors were incented to do more, not to do better, where they got paid a lot more for unblocking the coronary artery and preventing it from being blocked in the first place, where we knew that adding 10 primary care physicians to a community increased life expectancy 2.5 times, adding 10 specialists, and yet we were training a lot of extra specialists. The care was fragmented. It was like a 19th century cottage industry. Doctors spread across the area. The technology was left over from the last century. And actually, it wasn't, Patrick. It was left over from the century before that, because the way doctors communicated was through the fax machine and the 1850 invention. And there was no leadership. Doctors weren't trained to be leaders, and there was no structure in which to work. And so I went around the country speaking about mistreated. I began with my father's untimely death from a medical error that was quite significant emotionally for me. And I got a very good reception.
Wow.
4 years later, nothing much had changed. And so in the process of going from 2017 to 2021, I started to ask myself, okay, what's missing? I mean, if this approach to care is so much better, why isn't everyone just doing it? And what I uncovered was the culture of medicine. I speak a lot about the physician culture because it's the one that I know, a heroic culture, a culture that in COVID-19 saved tens or hundreds of thousands of lives, with doctors going to work without the protective gear they needed, 12 and 24 hours, being able to confront death without a whole lot of ability to do it. And then I also found some of the more problematic sides. And what I concluded in the end, and why this book, is that you can't change one or the other. You can't change the system without changing the culture. You can't change the culture without changing the system. You've got to move them both forward. And that's why I'm very excited, because this to me is the other bookend. to the healthcare conundrum. And hopefully out of this will come higher quality, better service to patients at a lower price that people can afford.
Dr. Pearl, I'm certain that good will come out of this, and I'm certain that it will impact safety, quality, and the physician experience, the patient experience, the provider experience. And you're touching on culture is near and dear to my heart. I'm so glad you wrote this book, and I have the great good fortune of having a copy of it. You can get that in the camera there, Uncaring. Uncaring, How the Culture of Medicine Kills Doctors and Patients. I want to comment on culture, but I also want to give a shout out to Dr. Serino, Christopher Serino. Thank you for dialing in. Saw your comment earlier. And Dr. Pearl, personally, culture is so critical to me. Coming from a Mexican mother and a Texan father, I'm Tex-Mex. And I grew up in a family in which my family spoke multiple languages, Spanish, English. My grandparents were Jewish, Catholic, and Protestant. I grew up in a family with people with different skin colors, lived in different countries, and practiced different religions, from Jewish to Protestant to Catholic, which can sound a little schizophrenic, but it's not. It's diversity. It's how we all come together. I'm bringing this up because culture is profound and powerful, and yet you can't see it, touch it, and at the same time, it is profoundly touching patients. It is profoundly touching patients, and the work that you're doing is doing some amazing things. And look at that as a shout out from Stephanie. Forgive me, Dr. Borelli. Grateful that you're on the show, but you're getting a shout out from her.
Thank you so much.
Yeah, so culture, this is so critical in the culture of medicine. And your intention, if I understand correctly, is not to pathologize physician culture, healthcare culture overall is a bad thing. What you're advocating for is recognizing, not throwing out the baby with the bathwater, but celebrating, recognizing what we're doing well, and also acknowledging what we're not doing well. And I've seen some of that underbelly of healthcare myself as a former hospital CEO. And as a psychologist supporting healthcare providers experiencing burnout, I see that in my clinical work. In your book, you acknowledge the challenges that both physicians, providers, healthcare, that patients are experiencing. It's touching all these people's lives in a profound way. And I'm curious, where do you want to go? How does the spirit move you in this conversation? Do you want to talk about the patient impact? Do you want to talk about the provider, the physician impact? Where does spirit lead you in this conversation?
Well, first, let me start by saying I have such massive respect for doctors. As physicians, they are motivated. They dedicate their entire 20s to learning a craft to try to save lives. They work in a very broken system. There's no question about it. The insurance system is a problem. The technology is a problem. The lack of a structure is a problem. They get caught in the middle often between different parts of the broken system. And in the end, they're the ones who are most accountable. But I also add, and this is a piece that a lot of doctors may not want to hear,
listen up,
that the physician culture, the things that we control, are also problematic. And again, a lot of doctors don't want me saying that, and I say it out of love. I talk in my book about my parents' love for each other and how my dad loved my mom without any question, that she was perfect. My mom could see the flaws of my dad, but she loved him just as much. I love medicine. The best decision I made professionally in my life was becoming a doctor. But that doesn't mean that we don't sometimes do things. In the book, I talk about racism. Yep. I talk about the ways that we don't treat patients who don't look like us. With your diverse background, I can almost say everyone looks like you and everyone speaks your language because you have such a diverse background. But it's not necessarily the case. And particularly for Black patients, we don't do a great job, and the mortality is 3 times greater. And we should own some of that. Some of it's the hospital, some of it's the insurance company, but we have a part that plays within it.
Dr. Pearl, you've got an interesting comment I've heard you say before about COVID testing and its impact on people of color and the disparity. Could you comment on that?
Sure. Early in the pandemic, you may remember we had a tremendous shortage of testing kits. And so often the emergency department doctor would come to work knowing that he or she had 3 kits. And who's going to get the 3 kits? Obviously, if someone came in that was the sickest, they were going to get it. But often 2 patients would come in. One was a black patient, one was a white patient. And they had the similar equivalent likelihood of having COVID. And the data says we tested white patients twice as often as the black patients, despite the fact that the people who were dying at twice to 3 times the rate were the black individuals in society. We also know that we gave 40% less pain medication to the black patients after surgery. And I want to make a point, this is such a difficult area. You're a psychologist and you have a tremendous expertise within it, that this is not done by bad people for bad motivation.
Right.
These are examples of implicit bias.
Yes.
We just know. I mean, if you go back evolutionary, 10,000 years, 20,000 years, a human figure is coming over the horizon. Is it a friend or foe? If I guess it wrong, I'm either going to kill someone that I like or someone's going to kill me who doesn't like me. We had to make these snap decisions. We call it thin slicing, being able to make a determination. And we're not even aware that it happens. And I've gotten asked, is implicit bias, is this racism? And I've answered to people, no. Implicit bias is being human. But knowing about it and not acting on it, that becomes racism. And that's where I start to criticize us. Because if the data is accurate, and by the way, they looked at the same thing for post-mastectomy reconstruction. We offer to black patients less often. Cardiac intervention with the same patients with the same EKG, the same symptoms, the same risk of dying. We do it less often. Maternal mortality, 3 times higher in black patients, except when the attending physician is a black physician. There are parts that are definitely systemic in terms of coverage, in terms of jobs, in terms of transportation, the social determinants. But there's a piece that we need to own, or at least take responsibility for fixing, despite the forces that are out there. And that's what I'm hoping, Patrick, that as people read the book, they're going to be able to understand it comes out of respect and love, not out of criticism. And the opportunities that I believe doctors can grab onto to make a change, despite the outside forces. That, to me, is the driver of the book.
Yeah, it's compassion. I mean, this show is about courage, compassion, joy, and hope. Your book and your efforts give me courage, compassion, joy, and hope. And what you're doing here, there's no personal benefit to me to be interviewing you about this book and promoting this book because I think it's amazing. And financially, the proceeds of the book go to Doctors Without Borders. This is good and true work. And your efforts here, Dr. Pearl, are Robbie, they are commendable. They are grace. And it's us in healthcare that can do something about it. And that is the physicians, it's the providers, it's also the patients. All of us are in this conversation together. And I'm curious from the book and the physician culture and the healthcare culture, what stood out to you in popping the hood of healthcare in your personal conversations? What stood out to you in your conversations with your colleagues about these topics? What kind of feedback, input, pushback do you get from your colleagues, and as well as support?
The problem that many physicians have is that we've lost status over the past few decades. In the book, I explore the reasons why. Because in many cases, we're blamed for things that are not under our control.
Right.
But some of the status lost. And remember, Sir Michael Marmot, the sociologist from England, has looked at what happens when you lose status and you lose fulfillment, you become dissatisfied, you get fatigued, you get all the symptoms of burnout because it's a sense of self-importance. And I think physicians are frustrated because they're working harder than ever.
Yes.
And so it feels very unfair, and unfairness is there as well.
Now more than ever.
The challenge to me is I don't see the world suddenly saying, oh, your doctors have it so bad, we're going to make your life better. For 5 years, we've been talking about burnout, moral injury, and I look, nothing much has changed. And so I think that we're going to have to take charge and make things happen. And there are people who believe that we're entitled to someone else doing it. That's better for patients, which is true, that we are working harder and harder, and that's true. Everything's true, but that doesn't mean it's going to change. And that's where I think that in many ways, I see the stages of Kubler-Ross happening. Again, as a psychologist, you're well aware, you start with denial, then you go through anger, and then finally bargaining to depression and to acceptance. And acceptance is the end. Doesn't mean we're going to like it. It's just the reality that's there. And I think a lot of people are still in denial and in anger, and I don't blame them. But the purpose of the book is to help us at least confront all of that. But if I could ask you a question, Patrick, if you don't mind my turning it around a little bit, again, because you have your expertise in that arena. Part of what's happened in the physician culture across time is that we've used repression and denial as a necessary set of coping skills, not in a pathological way.
Yeah.
Just think about it. Through much of time, doctors couldn't do much. And it would be heart-wrenching to see a child in the process of dying. You know that the child is getting weaker and weaker and weaker, and you have nothing to offer. And how do you face that reality? How do you sleep at night? How do you come back the next day and provide solace to other people? And so we learn to use repression and denial. In the book, I talk about my cousin who had Hodgkin's lymphoma early in the development period. And the medications at that time were horrific. He spent weekends vomiting, gut-wrenching pain. Yeah. His doctor was by his side all the time. The dedication was there, but he had to have the repression and denial to not see the suffering in order to advance it. And today we're able to provide care as a result of that. So the repression and denial is not negative. I think in many ways, particularly in the right circumstances, it's positive. But now to you, I throw the question. Right now, I think the way doctors are surviving in the coronavirus era. I talked to one doctor who lost 4 patients in one day. I mean, how do you deal with that except some degree of repression and denial? But when the coronavirus era is over, I worry about PTSD.
Absolutely. Ooh.
And physicians have been trained, suck it up. Don't admit you're hurting. Don't talk about feelings. It's bad for patients, for doctors to do that. I don't know how they're going to deal with the horrific tragedy of the past 12 months. What do you think we should be doing as a nation?
Oh, my gosh. Oh, my gosh. Huh. The man who hosts several podcasts and asking me that question, what do we need to do as a nation?
Psychologically,
psychologically addressing the physician's needs. I'm seeing actually a physician just commented, it's already happening. And a post from Dr. Serino, physicians that I talked to like to say how grateful they are to have the privilege of being a doctor. True, but they also carry a lot of stress on their backs. Absolutely, that's the whole point. And Dr. Borelli as well, acknowledging it's happening. I want to acknowledge your question. And my best friend from high school, who practices in Fort Worth, Texas, his name is Dr. Chris Pratt. Dr. Chris Pratt, like the famous Chris Pratt, but this guy is a physician, surgeon, transforming patients' lives. I think about Chris. I think about my physicians colleagues here in New York. I think about whether they are intensivist primary care physicians, which we need more of, or whether psychiatrists or whether physiatrists, the physicians and the clinical leaders who were not just physicians, but clinical providers who were addressing COVID, responding, having been made heroes and sheroes, and then folks not wearing masks and spreading COVID and there being more mortality. I completely agree that there is a risk of post-traumatic stress disorder. I'm not giving medical advice through a podcast. I'm not giving a medical advice on a LinkedIn Live or Healthcare Live. But I want to acknowledge that what we as human beings need to do, number one, is be compassionate with ourselves. Folks walk around on this planet with many rules in their head that make it very hard to be happy and very, very, very easy to feel sad. And those rules we have in our heads about what it means to be a good person, what it means to be a good physician. You touch on status, Dr. Pearl. The sense culturally that there's this idea in order to be successful, you have to have the status and all the trappings, and then one achieves that, and then they're disillusioned, disappointed. So in my practice as a psychologist supporting burnt out healthcare professionals, the number one is to have compassion for yourself and acknowledge you deserve that, because the world isn't giving it to you. There are employers. There's Quint Studer is having a symposium about gratitude, leading conversations and how we can care for our staff, our employees, and our physicians, and those in healthcare. But I'll summarize that this pandemic is becoming a mental health pandemic. And in my practice, there are providers who are overwhelmed by the post-traumatic stress-like symptoms that they're experiencing. And a critical part of that is taking a deep breath and compassion for oneself and looking for help. And your book, this book, Uncaring, How the Culture of Medicine Kills Doctors and Patients, is part of the solution. It's not the answer. It is part of the solution that I really want to encourage folks to pick up a copy of it, because you have so much wisdom in there to address these issues.
Thank you.
So thank you for turning that question to me. I'd love to ask you more about the patient experience. I asked you about popping the hood in the world of Dr. Pearl about what it's like talking to your colleagues, right? What about patients? What have you received letters, emails from patients and people who receive healthcare, and their thoughts about Uncaring, your incredible book from before, as well as you're Mistreated, your incredible book from before, as well as Uncaring. What patient feedback have you received about this?
Gotten very, very positive patient feedback for two reasons. The first one is that patients are well aware of the challenges that exist. 2021, where we are right now, try to think about what it's like to schedule a trip to Greece, not with COVID, but an airline and a hotel, against what it's like to try to schedule a doctor's visit in your own community. You can go online on the internet, you can book the hotel, you can book the flight, you can do a whole slew of things virtually. You have tremendous cost, tremendous transparency, and it's very hard to do it for physicians. Now, again, the systemic issues are there. How much doctors are being paid to do these types of things. But I also believe that in the culture, it's left over from the past. That's what I want viewers and listeners to be understanding. You learn the culture in medical school and residency. If you're in your mid-career, you're having to do things that are 15, 20, 25 years from the past. Just think about this one thing. What do we call that area after you go into the doctor's, you open the front door to the doctor's office? What do we call that area? It's a waiting area.
Room.
Yeah. Why isn't it a reception room? Why isn't it an intake room? Why isn't it a meditation relaxation? It's a waiting room with the intention of telling the person your time is not as important as my time. Now, again, there's an efficiency piece that sits there, but we could place it in a different context. Think about the fact that we close our offices, most places, 5 or 6 o'clock at night, and we send patients to the emergency department. Now, again, it's not that one doctor is capable of covering 24 hours, but 10 doctors, 20 doctors, with one being responsible in each of these time periods. Imagine how much better the care could be. Or look at telemedicine.
Yep.
I mean, 7 years ago, I read an article about telemedicine, talking about the fact that in Kaiser Permanente, when I was the CEO, we were doing 14 million virtual visits a year. The rest of the world was doing 1 or 2%.
Yep.
And I predicted that 30% of what we did would be done virtually. And for 6.5 years, Patrick, you know what happened?
What's that?
Nothing. Nothing changed. And then all of a sudden, COVID comes around. And as physicians and staff, we don't want infected people coming into our area. And all of a sudden, we're doing 60 or 70%. It's not that we couldn't have done it.
Yep.
We just didn't value doing it. And now, culture's about the language and the stories. Think about two patients, one of whom needs to be seen, gets an appointment 4 or 5 days later, takes a day off from work, comes to see the physician, and someone else gets an immediate telemedicine visit. Problems diagnosed, the problem solved. No, not everything can be solved. Things sometimes need to have a knife or a needle put into the patient. But we don't value that. And that's what culture is about. And again, I'm going to say it again and again. It's not bad intent.
Right.
It's just the norms that we learned. It's just the way we believe that medicine should be practiced. And I think we could change. I actually think we could make our practices be partially telemedicine and improve our own satisfaction.
I completely agree with you. Absolutely. I mean, I was a patient experience officer for New York Presbyterian, one of their hospitals. And there is so much we can do. Starting also with the how we title that role. It's the human experience as opposed to just the focus on, not just, but it's how we think about things at our culture as we work to improve. And I want to give a shout out to Dr. Serino. He wrote, and it just slipped my screen here. I have a lot of ideas that come from improving the waiting room, more of an exploration room, information areas in order to meditate. And Julie Johns wrote, we're already substantiating the presence of mental health impact. It's no longer the discussion of risk. We are creating mindfulness and wellness practices as part of our daily operations. And I think, Dr. Pearl, your book is part of substantiating the gravitas, that this is something we need to do, we can do, and we need to do it. And COVID has brought so much sorrow. And yet all this change has led to incredible creativity and identifying solutions. And the point I want to make here, I'm trying to make here, Dr. Pearl, is that there are middle managers, new folks. My podcast is about healthcare and leadership. It's for the new person as well as the seasoned CEO, but it is the leaders like yourself writing a book like this that is substantiating this is the future from the gravitas of someone who has been in your role. And I just want to acknowledge that there are listeners, and now I'm seeing on this, this is the first time we're doing this LinkedIn Live. There are lots of folks that are tuned in. I just couldn't see the number. Dr. Pearl, what you're saying right now, I know is touching people's hearts and inspiring them.
So for the leaders, Patrick,
let me share. Linda Massano, she wrote, Patrick, thank you for hosting this important discussion. It's so insightful for folks like me outside of the healthcare system. I appreciate you and Dr. Pearl. Yes, I'm raising my awareness of what physicians are experiencing today. Linda Massano, thank you so much for that comment, because it's acknowledging, Dr. Pearl, that it's not just healthcare folks that are talking to healthcare folks. It's all of us together in this big tent. From cultures, from many perspectives around the planet, and how we think about this. But please, you're about to make a point.
I was going to make the point, your show is often for leaders in healthcare, whether they're physicians, whether they're administrators, whether they are staff people who are leading other staff people. I've always said that, the majority of people in healthcare are leaders, one way or another, whether they lead within the office, whether they lead within the hospital, whether they lead in the support department, whether they help to lead patients or work with patients to be able to get better outcomes. And I have, as part of the book, the 5 C's. And the first C is to confront the problem. And I think I wrote the book to help people confront it. They may not like it, but it's a reality that's out there. And I think if we talk to patients, they'll talk about the frustration. I receive probably 40 emails a day from people who have read the book or heard me speak, talking about their own frustrations, getting the care that they believe that they need and deserve, and they can't get it. And then committing. It's one thing to say there's a problem. It's another thing to say, I'm going to commit to being an agent of change. Because as long as all you're going to do is say, I confront it and it's your fault, you got to do something. Nothing much is going to happen. And again, I say to people, even if it's 10% of the problem, let's confront that and commit to making that change. Because once you decide to do that in healthcare, the next step is connecting. And as strange as it sounds, you would think that we in the healthcare world would be fully connected with everyone else. We're not. Even our record's not connected. Our actions are not connected. No. I talk in the book about my mom, who at the end of her life had 5 or 6 different specialists. They never talked to each other. Yeah. They each wrote orders in the chart. Yeah. Sometimes the orders, by the way, conflicted with each other.
Sure.
And then once you connect with people, the most important next step is then to collaborate, to coordinate the kinds of things that are needed. And that's where primary care's role today is not getting even a fraction of the value, because that primary care physician is the individual who touches all the organ systems. And we need that individual to be very much front and center. Right? And then finally, it's contribution. And this, again, when you're a psychologist, my observation is that we've lost so much about mission and purpose. Some has been stolen from us by restrictive and bureaucratic insurance companies, and avarice pharmaceutical world, and bad computer designers. There's a whole lot of ways we can say it's been stolen from us, but I think it's also been given up by us.
Given up, right? Yeah.
In a way.
Yeah, because those folks are also partners. Yeah.
And part of why the profits go to Doctors Without Borders is I've done a lot of global surgery. And it's always amazing to me. You come back from a trip, you've worked 12 and 14 hours a day in hot Central American countries repairing children with cleft lip and cleft palate, no air conditioning. You've had rice and beans, you've had intestinal discomfort, and you're coming back with a smile that's bigger than you've ever seen before because you made a difference. I talk in the book about a doctor who volunteered to go to Liberia to take care of people with Ebola. It was so hot in the suit he had to wear, he had to have IV running into his arm so he didn't become dehydrated and pass out. And he came back as though he won the lottery. This opportunity that's there. And it's so hard to see that when you're starting at the other end of the spectrum.
Yeah.
Because what you can see are all the problems and the shortcomings, and they're all there, Patrick. But understanding how much we've given up, you mentioned it before. I mean, in the book, I talk about Laurie Santos, the psychologist from Yale, and her book on happiness, and how we tend to view things that are going to give us happiness that she's proven that don't, and other things like gratitude you mentioned earlier, and the ability to take care of others. These are things that have been proven time and again to be far more valuable. And somehow, in the passage of medicine, I think left over from the cultures of the past that we inherited, I think that we have some responsibility to be able to recognize what we're doing to ourselves. And that's why I call the book, How the Culture of Medicine Kills Doctors and Patients. And we know there's 400 physician suicides a year, tragic loss of people, of loved ones, of tremendous ability. And in many situations, they just can't see the hope that's there. I'm hoping that through the book, we're going to be able to resurrect what has been there, I think, in the past, and has gotten lost in the current 21st century.
Absolutely. I pray that that occurs as well, because there's so much at stake with your title, How It Kills Doctors and Patients. And those numbers are underestimates, right? And they're, if you look at globally what's happening with physician suicide, and healthcare professional suicide. And earlier you asked me about the pandemic and the PTSD pandemic. There are folks who are having more thoughts about that, thoughts of suicide, and there is hope and there is inspiration. This show is about courage, compassion, joy, and hope. And there's another comment here from Joelle Hoagie. So many powerful concepts. Sorry, Dr. Pearl, I'm covering us both in order to show this post here. So many powerful concepts. As someone who is not in healthcare, we need for everyone to participate in this conversation. Change, connection, collaboration, contribution are all so important across multiple areas within healthcare and across multiple industries, fields. That's how we can affect change. We all have a huge stake in making this change. Thank you, thank you, thank you. Thank you, Joelle, for that. Because acknowledging the impact of depression, anxiety, suicide, etc., we need change, and change in the spirit of moving forward for good. I love the quote, people don't choose evil for evil's sake. They mistake it for happiness. And the incentives that are in place in healthcare right now are moving us in the wrong direction. And your book is a call for, I can say, progress instead of change. I know the word change can be a trigger for folks, that they get contracted. Even the notion of progress, making things better so that folks aren't feeling depressed, anxious, suicidal. They're feeling hopeful and inspired, and there is hope. And your book, Dr. Pearl, is chock full of hope, and also practical solutions and things we can do. Oh, hell, you've got suggestions for patients what to do in the office, right?
So I have in a chapter 9 sets of questions that patients should be asking their doctors. And I'll just go maybe over 3 of them, Patrick, since I want to leave time for other questions.
Sure.
But if you think about, you go see the physician for a problem, that's likely to get better. It's relatively minor. Let me get a little drink from my throat. Sorry.
Please. And I appreciate, I've heard you on other podcasts talking about, this is a live show, but talking about these questions. And I want to encourage folks to perk up your ears. What you hear now from Dr. Pearl could save your life, improve your life, but not just for yourself, but for your loved one, right? So, Dr. Pearl?
So this is the kind of problem where you need to see the physician. He or she needs to do something to make a diagnosis, and then you're waiting. And what does the doctor say? Come back in a week or whatever. No. Ask questions. Can we do this by text? Secure email. Can we do a video visit? How about a phone call? Why do I need to miss work or school, drive through traffic, and come to the office? Now, if I have to, no problem. But most of the time in a follow-up situation to that kind of not life-threatening, relatively well-manageable problem, how do I get the same convenience of my healthcare that I demand in the rest of my life? Then you have a set of problems that require some type of intervention, a surgery, a procedure. And they're the questions you want to ask. How many of these did you do last year? How many would you require if you or someone in your family needed this operation or this procedure done? What's the worst complication you've ever had? What are the chances of my getting better? Is it 90-10 or 10-90? What are the chances of a complication? It's this information, and I think patients all too often feel hesitant, embarrassed. This is their life. And again, I think that we inherited a culture that I'll say is a patriarchal, because it came from a lot of men who were leading it. And it's not what you said patients want today. And I think they need to understand that they deserve it. And asking the questions, they should ask them respectfully, but be aware that this is their life. And then finally, what I point out in the book is that as physicians, we're not very good at dealing with death. On my podcast, I had a woman with terminal cancer. And I said, you've had this disease for a while, over a year, knowing it's terminal. Has any physician talked with you about the end-of-life issues? And she said, no. Others have, but we avoid it as doctors. And so the questions you want to be asking is, what will be some of my options that I have? Will you be able to control my pain? Because pain is one of the big fears that people have. And then finally, at the end of my life, when I decided I don't want any more treatment done, because now I've gone through so many rounds of chemotherapy, now I've been in the hospital so many times for my heart and my lung problem, will you be there for me? Or will you desert me at my most needy time? You know, as I said, in this treat, I talk about my dad's experience. And at the front of the book, I talk about the medical error that led to his death. And I don't blame doctors in any way for it. It was the lack of a computer system. Information was not well shared. There was, he had doctors in New York and in Florida, and there was a communication set of issues because the system's not designed to facilitate that. And I gave all the systemic reasons. But at the end of the book, I talk about how he had a bleed into his brain. And my brother and I flew from California to Florida, where he was. My sister was already at his bedside. And there he was, strapped down with a breathing tube in place and an NG tube in place, and doctors lining up the door with ENT wanting to do the tracheostomy, and GI wanted to put in a feeding tube. Neurosurgeon wanted to take out some of his skull to let his brain expand. And my brother's a physician, and I both looked at the x-ray. We said, he's not getting better. This is not what he wants, even if he were to survive. And we said, thank you for the care, but no thank you. We'd like nothing else done. And for 2.5 days, we never saw another doctor. You see, in the physician culture, if you can't do something, you don't see that you have a role to provide sympathy, as you say, and empathy to the family, to support them in this most difficult time, to be able to have this continuity of life unto death. And we don't do a very good job at that. And I think actually it harms, again, both the doctor and the patient, and inflicts pain that we deny and we repress. But as you know, as a psychologist, denial and repression is like a fine-grained sieve. The emotions still get out, and they affect us, and they're painful, and they're harmful. And we should be able to acknowledge it and get the support and help that we need.
Yeah, and ask for help. Ask for help. Seek support. Sublimate in the sense of bring about good from that pain as well, in the way that you've produced this book and shared that story, Dr. Pearl, that you're talking about the invisible in healthcare. You're talking about the culture. And I want to acknowledge earlier, you said, in the wisdom you shared for what patients can ask in their appointments with their physicians, they may feel embarrassed and not want to ask the question. And I think that also speaks to this invisible culture, where in a patriarchal dynamic, in a power dynamic, the patient doesn't feel comfortable to ask the question that they're dying to ask. And that can have a tremendous impact on their life. And the compassionate master physician, clinician, would want their patient to ask the question. And their heart may break if they knew that they had a question and it wasn't asked. And one of the things when I used to lead the settings as an administrator, CEO, as a clinical guide, the importance of our fellow professionals asking the question, what questions do you have, as opposed to, do you have any questions? You know, that question, do you have any question? The answer is a yes or no, as opposed to, what questions do you have? That open-ended question. So I encourage our clinician colleagues to ask that question in that manner. What questions do you have, as opposed to, do you have any questions? Because it tamps folks down. And so I want to acknowledge the wisdom you just shared, and celebrate that you're elucidating this culture in your beautiful book. And I also want to talk with you about, while we have the show, what's it like, Robbie, being an author who's promoting a book that's having an international impact? What's it been like for you? What surprised you, and what have you enjoyed?
If I look at the difference between 2017 and 2021, it could not be more diverse.
Sure.
You know, it's 2017. I spent time at bookstores. I spent time at large conferences with 500, 5,000 people. None of that's happening now. Some of it's COVID. A lot of that is the evolution. This is my third or fourth podcast of today. I can't keep track anymore. I've probably done 50 of them in the past 2 weeks. It's a whole new way of reaching people, and I like
God bless you.
Well, no, I like it because it gets to a diverse audience. What I recognize is that to make real change happen, you've got to engage at least 30% of people. And they've got to come from a diverse background. You can't just deal with your friends and the people who think like you. And that's one of the challenges we have in America today, as everyone wants to talk to the people on social media who are just like them and never engage with the people who have a different opinion.
Yeah.
And I think that's I'd say a little bit of what I'm experiencing right now. I'm experiencing a tremendous amount of engagement from around the world, from across the country. I mean, the book's been #1 on Amazon for a while in healthcare. And at the same time, I think I'm also running into individuals who don't like it. And the social media world
Trolls.
boils up with all of people's emotion in an anonymous kind of way. I just wish they all could come on your show and engage with us in some kind of huge round table and talk about the issues and be able to express the frustrations that doctors have, that patients have, with the system and with the culture, because that's the only way I think that we're going to make change. If not, I think one of two things will happen. We'll get slowly worse, or someone who's not a clinician will come in and lead the change. And I have greater confidence that healthcare professionals can do this well, along with patients, rather than an external entity coming in and dictating how the future of medicine will be.
Your lips to God's ears. It would be incredible to have a show where we can bring folks under the tent. I'm a guy driving home from work. I'm listening to Fox News and CNN and MSNBC and NPR and BBC because I want to hear diverse perspectives. So, I just need Pfizer, Stryker, Hillrom, someone to sponsor some big tent kind of experience like that, because it would be incredible to be able to have that conversation. And I want to acknowledge a comment here from Joel Hoagie. I'm going to read it, which is going to cover your face, Dr. Pearl, but it's a one-man band here show. And here's her question. My apologies, but her question, because it relates to bringing people together. She writes, how can non-healthcare professionals, I take it Joel Hoagie is not a healthcare professional, GPHR. So question, how can we non-healthcare professionals reinforce the need for what Dr. Pearl is saying when we have family members who are severely ill, and do it in a way that we're not spoken down to or shut down? What do you say to that, Dr. Pearl? Great question, Joel. Thank you.
It's a great question. It's a question that is on the minds of a lot of people, because that's the challenge they have when they intersect with both the healthcare system and the physician culture, or the culture of medicine. The first thing that I would say is to recognize that this is your life or your loved one's life or someone who means a significant amount to you, and you're entitled to this. And I think that that's a major shift for patients, because they've been told, no, that's not what you're entitled to. Your job is to listen to the doctor and do what the doctor says. And so there is this, I'll say, cross current against the physician culture that's there. But what I tell people is, before you go to the doctor's office, before you go to the hospital, before you go to wherever the intersection is going to be, write down the 3 most important questions. Don't bring 20 questions. Don't bring 10 questions. If you have that much concern, you're not going to solve it in one visit. And it's part of why doctors wait, I think, something like 11 or 12 seconds before they interrupt the patient, because the time press exists. And it's real, again. It's imposed upon them. But some of it is the fact that they are fearful. They have fears too, that they're not going to be able to complete their day and complete their job. So what are the 3 biggest questions that I'd like to know when I'm in your office? What are the 3 biggest questions I have for the intensivist taking care of my mom and my dad in the unit. Now, again, there's some limitations in HIPAA. You got to be aware of that.
Sure.
Because without permission, they can't tell you anything, even though you're their son or daughter. It's still their life, assuming that they are able to have the mental faculty to do it all. But that's what I would say, because it goes back to what we said earlier. If you have those 3 questions when you walk into the office, you don't get flumoxed and at the end say, oh my gosh, I forgot to ask it. I'll ask it next time. You basically say 1, 2, 3. Now, if you're lucky and you have a doctor who will provide for you some kind of modern technology, you can send them in advance. I'm coming to see you, and I want to understand the side effects of this medication. I want to understand what happens if I stay with medication versus surgery, and I want to understand the likelihood I'm going to get better if I have a surgical procedure, or whatever those 3 things are. And then the individual can understand exactly where you're coming from. The challenge you're going to face is that most doctors won't allow you to do that today. So you better walk in with your piece of paper and be very clear that these are the 3 questions I have. Not 30, but these are the 3 answers that I'd like to have by the end of our time together. And I think most physicians will respect that, even within a 15 or 20-minute office visit.
Excellent wisdom. And there's a comment from Linda Misano. A great question and great advice. Thank you. Your advice, Dr. Pearl, is practical. There's wisdom in this. And there's profound positive impact that comes out of this. So this book tour, you're doing all these podcasts. What's next, Dr. Pearl? Robert, what are you up to next in this work? Where are you going with all this?
This is going to be the focus for a while. Come the fall, already there's about 30 different conferences that have booked me for a keynote speech.
Awesome.
Yeah, because this is a theme that's resonating with their people. These are conferences that were canceled last year and this spring, but I think people are getting ready. And everyone listening in, make sure you're vaccinated. It's going to be the way out of the pandemic that exists right now. But that's what I'll be doing next, and engaging with folks and trying to generate the momentum, Patrick. As I said earlier, if you look at how change happens, it starts with a couple of people who have a pretty radical idea. And then they find a few other people, probably the listeners, and who are connectors. And I want to encourage all of you to reach out to your diverse social networks, the lots of people that you know that Patrick and I don't know, and let them know about the book. Let them know about the ideas. Bring them into this tent. That's the second phase. And then you have to get a critical mass. And I think a critical mass is possible. It's possible amongst patients, because I don't know very many who find the care they get convenient. They're grateful for the care. They got great physicians. They're frustrated by the system, but they can't get the convenience. They can't get the ease of access. They can't get the answers to their questions as well as they should be. And that's going to be what I'm trying to generate. How do I get that momentum? Because I think that there's a general framework that I present at the end of the book about how we shift the way we pay healthcare providers so that they get paid a set fee to take care of a population of people. Because when you do that, the culture evolves and you start to value prevention more than you do in a fee-for-service world. You start to value avoiding complications from chronic disease. You start emphasizing patient safety, because these are all ways that now you can do better in the economic world. You start to bring in technology like telemedicine. You start to be willing to follow evidence-based approaches. You start to do a lot of things in that particular kind of arena. So that's the goal, my goal and my hope. I'm going to continue to do the podcast and bring individuals in. This season we did focus on the culture of medicine. Had some really great shows on and why physicians have difficulty with much of technology, not the things that are $1 million shiny and new, but the things that are actually going to help consistently get good outcomes. Focus on racism and sexism, end of life, all the issues that are there. And next season, I want to focus on each of the pieces of the healthcare system. So my Fixing Healthcare podcast, I want to look at the insurance industry, and I want to bring on the show insurance leaders who can say why they think what they're doing is so good, and then I'll have the chance to ask them some tough questions about maybe why it's not. I want to bring upon leaders of the physician societies, maybe the head of the AMA. We'll see. If that individual is willing to come onto the show, we'll see. Heads of pharma companies. And I think my goal in all of this is to let people talk about the positive. And that's what I try to do in this book. I talk about all the good stuff about that physician culture, the lives that it saves, the heroic actions, the courage that it generates, the way we're able to repress fear of our own life, but then to be able to confront the challenges that exist, commit to that change, and then come together to connect and collaborate and coordinate. And finally, in the end, I think, be able to make sure that we contribute in a way that reinforces the mission and the purpose. That's my hope. We'll see how it goes over the next year. Maybe I'll come back 12 months from now and give you a status update, Patrick. Like that
I would love that.
You're going to have 100,000 viewers on every single show, and they can't wait for you to do it more often.
Robbie, your lips to God's ears. You could make me cry on that one. I pray that prediction comes about because this is a labor of love, and these kind of conversations are so critical. And I want to thank folks who have been listening and commenting. And there's a long comment here. I'm going to summarize it here. That there's a person who wrote, hearkening back to in the beginning of the show, they were responsible for procuring health benefits for an organization that had a large population in California and one on the East Coast. And they write, it was astounding the difference in overall cost and benefits between what Kaiser Permanente was able to provide versus the other providers. And they make the point, I believe we need to expand the Kaiser Permanente model. It will help better democratize healthcare. And what you just laid out in this vision and the arc of me asking you, what's the future hold? And Dr. Pearl takes us through this vision. This question I love because it talks about acknowledging best practices that Kaiser Permanente was doing, but it's not Kaiser Permanente. Yes, it is Kaiser Permanente, but it's also people putting their heads together, finding ways to improve healthcare, like was done at Kaiser Permanente, and the benefit that had for patients, families, providers, the whole system, and acknowledging that we can do better by looking at our best practices and how we can bring folks together under a larger tent to have these kind of conversations.
Well, it's a great analogy because part of why Kaiser Permanente is successful, part of why the Mayo Clinic, another great example, is successful, is that we trace the roots back 80 and 90 years to mission-driven, purpose-driven founders. It was the Mayo brothers and the Mayo Clinic. Kaiser Permanente, it was Dr. Sidney Garfield. And he actually almost went bankrupt, Patrick, because in the fee-for-service world at that time, not a whole lot of people had insurance. And the workers building the California aqueduct, which is where he was, would go to LA after they got paid on Friday, spend their money across the weekend. And then when they got sick on Monday or Tuesday, they couldn't pay their bills. And he could have just pointed the fingers at the lack of insurance and blamed the workers. But no, he came up actually with the idea of a prepaid cost. By the way, it was a nickel a day for the worker and a nickel a day for their family. So it's a little different than today. But what's so interesting to me is then he started going around the work site and knocking down protruding nails. Because as soon as you are paid in a different way, your behavior starts to change because what you now believe, what you now value, the norms that are there start to shift. And if I can leave one thought with the viewers that are here now, the large audience that has gathered, is to understand this intersection of the system and the culture. Not one or the other. The two go together and they reinforce each other. So as the system moves, as you say, in a direction that's better for patients and patient care, the culture moves with it. And as the culture moves, the system moves. And I think we can make American healthcare once again the best in the world, which is not today, but we have the potential, we have the people, we have the dedication, we have everything in place. We have to just make the commitment to make that change happen. And I'm hopeful that will be in the post-coronavirus era.
Absolutely. And I believe the book that you've written has the template and the wisdom for us to advance healthcare around the planet. including American healthcare, but healthcare on the planet, because there are listeners to my podcast, and certainly your podcast, absolutely, that are Eastern Europe and South Africa and South America and all over the US and Asia. And these concepts are things that we can do to move things forward. And I want to ask you, in that spirit, what would you say if you had the attention of all the healthcare folks and non-healthcare folks? If you had everyone's attention around the whole planet right now for a brief moment, what would you say to them?
The first thing I would say is health is a gift and we should protect it. The second thing that I would say is that it's all of our responsibility, both the providers of the care and the receivers of the care, because in the end, we're all patients. And we have to take care, as you say, of ourselves and the people around us that we love. And then finally, I would say that just talking about a problem is not enough. Every nation has a healthcare issue of some sort. Yes. I focus on the ones in the United States, although a lot of my followers are in Australia and in parts of Europe. So I understand the systems that are there, but I talk much about the system I know the best. But simply pointing out what exists and expecting someone else to fix it is a fool's errand. It doesn't work. And we, the leaders, the patients, the people of this country will need to pull together to make it happen. Don't underestimate how big the task is, but don't underestimate how wonderful it will be if we can get to the end.
Love it. Love it. Love your wisdom. And Dr. Pearl, of course, I've got to ask you, how can folks get a copy of your book?
The easiest way to do it is to go to my website, robertpearlmd.com. I don't sell them there, but there's 9 providers of the books. You can pick the one that you prefer to buy it from. That's the easiest way to be able to access the book. And you can order it online and it'll be delivered to your home. And think about who else you might want to send it to. Is there a family member? Is there someone, a friend of yours, someone you used to be friends with who lives in a different part of the country, a different part of the world? The more people who can get the book, yes, the faster change is going to happen, yeah, and the more that Doctors Without Borders will benefit.
Right. The proceeds from the book go to
Doctors Without Borders, yeah, an amazing group that today is in India dealing with the COVID tragedy that's happening in Brazil, where the same problems are there. It's a wonderful organization, and I can't say enough good things about it. And that's why, as I say, for both my first and second book, that's where the profits are donated.
Outstanding. So, Dr. Pearl, I want to acknowledge our folks who have been listening. We've been going strong. This is the first Swift Healthcare Live episode, and I'm so grateful for folks to be able to dial in. Thank you. Thank you for folks who have commented and questioned, sending questions, and please give it a thumbs up on your social media while you're watching this. So would love to see folks being able to do that. And most importantly, Dr. Pearl, Dr. Robert Pearl, thank you so much for being on the show. And I want to read the title again: Uncaring: How the Culture of Medicine Kills Doctors and Patients by Robert Pearl, MD. Dr. Pearl, thank you so much for being on the show. It's been
and I want to compliment your audience. I've been on a lot of shows. The questions they asked tonight was probably the best set of questions I've ever gotten. So keep up the great work. It sounds like there's tremendous synergy amongst everyone. And I'll go back to what I said before. Together we can, once again, make American healthcare the best in the world, and other nations race us to the finish line so that we can make the healthcare of the entire globe be far better than it is today. And get yourself vaccinated, please.
Outstanding. Well, Dr. Pearl, again, thank you for your wisdom and your inspiration, and for the book. And for those of you who have been watching this whole thing, we started with Candelian featuring Cara D. In the beginning, I had some beautiful music to listen to. And you know what? I was telling Dr. Pearl, I can't think of a better way for us to round out the show But to end with a song, Even If the Sky is Falling Down, it's a beautiful tune. We're going to end on that because there's inspiration, hope, joy, compassion. And again, thank you to the audience. Thank you, folks, for dialing in live, as well as folks who are going to be watching this after on LinkedIn and YouTube and Facebook. And certainly want to encourage folks to subscribe to the Swift Healthcare podcast. That's at swifthealthcare.com/podcast, or follow us on Swifty Health. Dr. Robert Pearl has multiple podcasts. You've heard from him and his depth and breadth. I want to encourage folks to Google Robert Pearl, MD. You'll be able to find his shows. And most importantly, the book, I want to encourage folks to pick up a copy of Uncaring. It will advance your understanding of what's going on and give you some inspiration as well. So thank you. Dr. Pearl, I'll give you the last word.
Thank you, Patrick. You're a leader. You're a believer in people, and you're going to make the world better, make our society better, make our lives better. So thank you for hosting your shows. I've enjoyed being on them. Thank you so much.
Yes, sir. It's been a joy having you. Thank you, folks, and we'll round it out with some music. God bless all.
Life is a winding road, no telling where it goes. Driving through days and nights, won't stop for traffic lights. And I really wanna know if I'll ever figure out where the road goes. Even if I'm falling down, I will keep on searching for my highs. You can say I lost my mind, I will keep on holding my head high. Even if the sky is falling down. Jumping from cliffs so high, trusting our wings to fly. Sometimes we're crashing down, but we get up and start from the ground. And I really wanna know if I'll ever figure out where the road goes. Even if I'm falling down, I will keep on searching for my highs. You can say I lost my mind, I will keep on holding my head high. Even if the sky is falling down, even if the sky is falling down, yeah. The sky is falling down. Even if the sky is falling down.